Hello, everyone. My name is Chloe Edwards with Voices for Virginia's Children. I'm our Advocacy and Engagement Manager. We specialize in a number of issues, including family economic security, mental health and health, child welfare, early childhood education. We're also home to Virginia's Kids Count Data Center, and we specialize in trauma informed care and equity. We're privately funded, we're nonpartisan. There's no conflict of interest when it comes to our advocacy. We do not directly benefit from any of the funding that we advocate on behalf of. And we've made this decision to maintain our independence and ensure there is no conflict of interest. Let's think about the impact of COVID-19 on family economic security. You see an unemployment graphic, and we are looking at high unemployment rates with restaurants closing down, with individuals who may not be able to work because of some sort of health issues, with things like entertainment centers not being in service. And so this has impacted a lot of our community members. We're also looking at an exacerbation of systems when it relates to the way in which equity impacts marginalized communities, especially urban and, for example, rural communities that may be more impoverished. And so communities faced already food deserts, which means that there is an absence of food nearby. If you didn't have transportation, you wouldn't be able to gain access to food. And so that may look like a lot of fast food centers in your area, which typically that can get costly every day. And so we also need to make sure that we are providing economic supports, including access to food for our communities. Lastly, communities have also depended upon community centers heavily, and some of these centers have closed down, especially when it is faith-based organizations, organizations where you may have more senior workers, or organizations that just couldn't sustain themselves during the pandemic. There's also parents who may not be able to afford childcare, and with children in virtual school, they may not be able to afford a nanny or something like that to watch their children. So this can also influence economic security. So there's a number of issues, but ultimately, when families aren't able to sustain their basic needs, this can lead to economic trauma, which is a stressor that can impact children as well as the parents raising children. And so we need to foster community level resilience. When thinking through this with an equity lens, note that 1 in 10 households in the United States before the pandemic faced food insecurity. Over 14% of adults reported that their households did not have enough to eat. You see the annual food budget shortfall in this graphic. There are 842,870 food insecure people in America, for example. Food insecurity rate in Virginia is 9.9%, which is quite high. There's a number of issues that can influence this, but ultimately it's poverty. And so what we're looking at is the intersection of poverty with nutrition, which can also lead to poor health outcomes. According to the United States Department of Agriculture's economic research, in 2015, 12.8% of the United States population lived in low income and low food access areas, which is also known, as I mentioned before, as a food desert. For Virginia, 1,186,877 of Virginia's population lives in food deserts. That number is quite high. But what we're also looking at is a population that is ruling and running the world right now. It is our frontline workers. I know you've heard that a lot on the news. However, according to the Virginia Interfaith Center for Public Policy, 1.2 million Virginians have 0 paid sick days or paid time off in general. 41% of private sector workers have no access to time off at all. In the United States, about 38% of African American populations and 50% of the Latinx population do not have access to a single sick day or time off. More than 30% of the African American households have no savings and cannot afford to take unpaid time off. And this issue is also intersectional because when you have to take a day off and you are not paid for it, this can also contribute to a worker known as the asset limited income constrained population, the income constrained employment population. And this population is just above the poverty line where they're not able to gain access to benefits, but also not below enough in order to have the benefits. But they also live month to month and afford and have trouble meeting their basic needs. And that's why we really need to give this population paid family medical leave or paid time off or paid sick days in general. And so what are the solutions? Well, one, we must expand paid leave options for parents to protect families and communities. If individuals cannot afford to take a paid day off, an unpaid day off, then that means that we could inadvertently be spreading the coronavirus because you got to choose between putting food on the table or working while sick. We also need to strengthen safety net resources for families, such as the Temporary Assistance for Needy Families, Cash Assistance Program, childcare subsidies, and then SNAP benefits in order to make sure whether a family lives in an urban, suburban, or rural setting, people collectively can access the resources they need to make their basic needs. Despite a recent 15% increase in TANF during special session, the monthly cash assistance has not kept up with the surplus and inflate related to inflation. And so we're advocating to increase eligibility rates, but also increase the percentage that of monthly cash assistance that families receive. Lastly, we need to increase access to affordable and healthy food options in underserved communities. And so food insecurity is an issue in cities, small towns, rural communities. It's really a geographic issue when you look at the differences of the struggles that different geographics face. And so what we're advocating for is the Virginia Food Access Investment Program, which would increase funding, a lot of funding to grocery stores, food hubs, mobile markets, farmer markets in order to build them in these food desert communities. And then we're also advocating for the support of the Virginia Fruits and Vegetables Produce RX program to create a fund that serves Medicaid and CHIP recipients. Again, it would increase access to food security by offering a prescription that folks could use at, for example, a farmer's market. While session is untraditional this year and virtual, you do have an opportunity to get involved through our Digital Advocacy Day. And so visit vakids.org and click events, and you'll find a number of events, including Advocacy Day training and MLK Day of Action that you can participate in. It'll all be virtual, but you can definitely still get involved. And if you have any questions, here's my contact information. And make sure you follow at VA Kids on all social media. And you can also follow at Racial Truth if you're interested in seeing our Racial Truth and Reconciliation Virginia's policy agenda, which also has the Campaign for a Trauma-Informed Virginia's priorities as well. Thank you for tuning in, and we hope to see you and engage with you during session.